Good morning, Johnny.
Right in the middle of it, man. We're hitting it heavy, hitting the road heavy. This morning, we really want to hit on some of the different changes with the drug plans and some of the other things that we need to know about the chronic conditions or the special needs plans. How can people use their food card? Because it used to be if they had a food card on their plan, they could just go and use it, but now they actually have to qualify for the food card with a health condition.
Yeah.
So that's something new for 2026 that we really want to hone in on and make sure people are aware of it.
Well, I think it's, how many calls are we getting? People want a food card. Everybody wants a food card.
Yeah.
So in order to get a food card, let's just clarify that. The plan has to either be a chronic condition plan or it has to be a dual eligible, which means you got Medicare, Medicaid. So up until this year, whatever the dollar amount was, they could use it on food or
Utilities
over the counter. Utilities over the counter. Well, for this plan year coming up, they stepped in and said, no, you have to use it on OTC if you don't have a chronic condition. But if you have a chronic condition, you can use it on both food, utilities, and over the counter. Now, what are some of the chronic conditions? I know we've talked about this morning. It's a big list, so there's no way we're going to cover every condition. Best thing to know is that your carrier you don't have to do anything. You don't have to call your carrier. They are looking at your medical records, your med history. They're doing the homework for you, and they're determining whether you are verified or not. But what are some of the main ones that we talk about?
So there's two. I just want to point this out. There's two different types of plans that qualify for the food card. The first one is called a chronic conditions plan. Most of those plans, if you have a qualifying heart condition like an irregular heartbeat, congestive heart failure, heart disease, and there's a pretty extensive list, or if you have diabetes. So those are kind of already thumbed through. They know, okay, this guy has to have a chronic condition to get on this plan. So you automatically are able to use the card for either over-the-counter or for food. Now, if you're dual eligible, that means you have Medicare and Medicaid. You don't necessarily have to have a chronic condition to get on a dual eligible plan. It's based on your income. So if you're low income, you got Medicaid and you qualify, you get on that dual eligible plan and it has a food card on it. Now, this is where it's changing. You have to have a chronic condition to use the food card on a dual eligible plan. So if you have low income and you're on a special needs dual eligible plan, some of the qualifying conditions, and it's pretty lenient and extensive at the same time, high cholesterol, hypertension, which is high blood pressure.
Yeah.
We've got cancer, chronic kidney disease, kidney failure, COPD, emphysema. There's a pretty extensive list of different chronic conditions that qualify you for that. Most everybody in the South where we work out of has high blood pressure or cholesterol.
Could be the food.
Or diabetes.
Yeah.
So, most people that have the food card, they're going to qualify.
Yeah.
But just make sure if you do have a qualifying condition that you've been to the doctor for that condition in the last couple of years so it's on your medical records.
Yeah.
It's important that they verify that or else you can't use it for the utilities or the food. You can only use it for over-the-counter is my understanding.
Yeah. And just to be clear, if you're a customer and you have one of these plans, you don't need to call them. You don't need to do anything because they are already in kind of prepping for 2026. They're looking through your medical record,
They're
your
doing like
drug
a data
histories.
match.
And a lot of times, just so people understand that, when we call them up, they get a little confused when we say, what health conditions do you have? What chronic conditions do you have? And they're like, I'm good. They don't want you to know they got something going on. I said, well, tell me about your meds. What kind of medications do you take? Because we don't have a record of all their medication. And so they'll say, well, I take Eliquis. Well, that's a blood thinner. So you obviously have some kind of issue going on with your heart. Or they, take another blood thinner. Or I take metformin. Well, that says that your blood sugar at some point need to be monitored, and so they got you on metformin. So a lot of times we can tell just by what medications they're on. But I think their instinct is to tell us how healthy they are. And we don't wish them to be unhealthy, but in order to use the card that they've been using, that's the hardest part for them. Some of these people had these cards for years, as long as the food portion has been there.
Right.
And all of a sudden you tell them, well, you may not be able to use it on food. And they're like, yeah, but I don't need $200 and some odd on over the counter. So what am I going to do? I said, well, the carrier is going to determine whether you qualify based on your health condition, whether you can use it for food or over the counter. It does not affect your plan. And that's really the point of the whole plan, is to make sure medically you're covered. So you'll still get all your medical care at no cost if you're on one of those plans. Now, not so much on the chronic, but on the dual eligible plans. So it just takes a little bit of explanation to people when we call them, just to make sure they don't get caught by surprise and go to the store in January and they scan their card and they can't get whatever it is they were trying to buy.
Right. I had a lady yesterday. I told you about this earlier, and I called her. I'm like, hey, I need to know of a qualifying health condition for you so you could use your food card. And she was thinking, oh, I'm perfectly healthy. She thought she needed to tell me that she didn't have any conditions. And I was like, I kind of need you to have a condition. Like, I need to be a little sick. So
just a little bit.
As we talk, she has high cholesterol, so we're good.
Yeah.
But just make sure that you have that conversation with your agent, or that you've been to the doctor. Don't not go to the doctor because you're so healthy. Go to the doctor and make sure that they make a record of your medicines so that the company knows you do qualify for that food benefit.
And if you get turned down for the food portion, it could be a matter of, if you hadn't been to the doctor in the previous year for that condition, it won't be documented. So you need to reach out to us. We can kind of do a little research for you and make sure that if it needs to be corrected, we can do that. Now, it's not going to work for everybody, but I think that the numbers I've heard, the averages are about 85 to 90% of people that are on dual eligible have one or more of the chronic conditions. I mean, it's not hard to have high blood pressure or have high cholesterol in this state anyway. So, just reach out to us if you've got any questions about it, because it is something that is new this year, a little confusing, and we want to make sure, people aren't caught by surprise. The next thing that we want to highlight today is really about the medication, the formularies, the drug plans, because what has happened is that there's a pretty good amount of change as it relates to what somebody pays for a drug based on the tier level. Some of them are fixed copays, some are percentages. And if you're not used to that, and also the deductibles went up. So, John, give us a few examples of things that our customers can look out for. That way, if they feel like it's not right, they can reach out to us. We can kind of analyze their meds and their costs and see if it's right.
Right. So in the past, there's typically been a copayment associated with the tier that you're on, the lower tier being the lower cost, the higher tier being the higher cost. Well, recently, especially this year in 2025, we've noticed deductibles, and pretty large deductibles, being placed on these drug plans. So some plans have a deductible for all 5 tiers, but most plans have deductibles for your name brand drugs, tiers 3, 4, and 5, or just your higher tier drugs, your tiers 4 and 5. So you need to look and review your drugs with your local agent and make sure these changes aren't affecting you. So that's one facet of it. The other one, we've always been used to paying a fixed cost for a drug, whether we had a deductible or not. Once we hit that deductible, we would pay $47 or $45 each month for our medicine. So you always knew it was very predictable what your drug costs were going to be. Well, next year we have some companies that are doing a percentage, which is called co-insurance. So this is a little different because you literally have to be proactive and calculate what your drugs are going to cost you. So if we have a drug that's $600 per month, I'm going to use Eliquis as an example, or we can use Manjaro, whichever and they have a high cost to the drug, and you've been paying $47 every month last year or this current year. Well, next year on some plans, you have to pay as high as 24% of that cost. So if Eliquis was $600, 24% of that's approximately $150. So instead of paying $47, now we're paying $150 a month for that drug. That's a large amount. And also, if it has a deductible of $350 up to $615, that's added on the front end. So you'd pay the $350 and then start paying 24% of the cost. And if you're not aware of that, you're going to go to the drugstore in January and you're going to be sticker shocked. It's going to be quite the experience. I don't want people going and not being aware of what the costs are going to be for 2026.
Especially if they hit something like $600 in January, and they just got through the holidays. They're not expecting to have to, peel off $600 to get their meds. And that can happen easily. I mean, we show people every day, hey, be ready for January. This is going to happen. Now, I do want to bring something up that you can do on your own, because a lot of people that have high cost meds, if you sit down with an agent and he explains your monthly cost, sometimes you have a big bill in January, a little bit smaller in February, maybe a little smaller in March, and all of a sudden it goes to zero. Well, that's because your max out of pocket is $2,100. So it doesn't mean you spent $2,100. That means you spent whatever you spent, and then the rest of it was spent by the carrier, but you did reach that $2,100. So the rest of the year, you're at zero, okay? Now, there's a thing called the prescription payment program. We don't have anything to do with it, meaning we don't actually sign you up for it. You have to call the carrier. But I was working with somebody this past week, and I realized they had such a high cost med that they were hitting that number in the very first month. And it was like out of their pocket, it was like $1,500, because it was one of those drugs that was in the percentage category plus the deductible. And he's like, man, I could do it, but it sure would be uncomfortable. And I said, you know what I would do is I would call up and get on that prescription payment program. They're going to take that money and divide it by 12, and then you'll just pay, a much easier price for the rest of the year instead of going all up front and then paying zero. Right. So again, that's an option. Again, we don't have anything to do with signing you up for that. We can certainly tell you about it. You got to call the carrier and make that transition. But what they do is they take whatever the bill is in January and divide it by 12. Just remember, though, if you do it again in February, like let's say you have a small amount left in February, maybe even March, if you do that again, they're dividing it by 11. Then in March, they're dividing it by 10. Well, now all of a sudden, it's like a layaway plan. They're adding money on top of that. So that number you started with in January is going to go up because you're adding February and March. And then eventually it'll level out. But if you get in that position, rather than not be able to pick up your medicine, definitely call your carrier and ask about that program, because it's there for a reason. It's not something that I would recommend everybody do, because sometimes it feels good to put it off, but then in the end you got to pay it, because you're not reducing what you pay. You're just reducing what you pay up front each month. So it's one of those things that, that it can help some people. And then maybe the other thing is to, if you don't have an agent and you're not sure what's going on with your drugs and your meds, because some people have signed up over the phone. Give us a call. It's 225-408-4100. Give us a call, and if anything, let us run your meds and give you some kind of a roadmap for the year and give you a little bit of help there.
Right. Feel free to pop in. The address is here locally in Baton Rouge, Louisiana, 7809 Jefferson Highway, Suite C6. We're in the Bocage Shopping Center area, probably a couple hundred yards from Bocage. Yeah. Pretty easy to find. Once you find us, you'll know where we are.
Yeah, or call us.
Give us a
guide you in. We're in the middle of AEP. We're not really in the middle, but we're, halfway through to the middle. So it's been a really busy time. A lot of people, are seeing changes in their plans. They're wondering, am I on the right plan or not? So we're helping people every day, all day long. So again, give us a call, come by and see us. Let us help you. And look, if you don't need to change, we're going to tell you, stay where you are. We're not just trying to move people. So let somebody help you rather than wonder if you got the right plan. And at the end of this segment, you'll see a list of our upcoming seminars by carrier that you can attend. And that way, at least you can make some contact with us, come in, reserve your spot, listen in on one of the carriers. It may not even be the one you're interested in, but at least you'll get some information. And then we can create a relationship with you and maybe help you from there on out. All right, John.
Very good, man. Appreciate this. Yeah. Good content today. Very valuable information. Y'all have a great week.
See ya. Hope you enjoyed our discussion today on Plus 65 Digital. Reach out to us at info@plus65advisors.com or give us a call at 225-408-4100. Make Plus 65 Advisors part of your Medicare process.